you're a future dental hygiene student wondering what you should study before you get in, this video is for you. Basically, you want to familiarize yourself with anatomy. But there's new words that you didn't learn in your prereqs, or you might have forgot. Let's start off with our regions. We have our frontal, orbital, our zygomatic, infraorbital, buccal, like buckies, mental region, thinking very hard with your mental, oral region, your temporal, parietal, and occipital. We also have our auricular region, which is our ear. The ear will be important because of clinical. If there's any piercings, you might need to name the piercings or any moles that are on those areas. You also have your auditory external acoustic meatus, which basically is like your ear hole. Then it's important to know about your salivary glands, your parotid, your submandibular, and your sublingual. And of course, we're going to go over lip anatomy. You've got your philtrum, it's a little groove in between your nose and your vermilion border. Then you have your turbiculum, it's this little point. You have your vermilion zone, it's the insides of your lip that look like zebra marks. The zone, vermilion border is like lip liner, and then vermilion zone is like lipstick. Then you have your labial commissures. Those are the corners of your mouth. Joker is a crazy clown. Commissure. Now, inside the mouth, this is called the oral cavity. You have your maxilla and your mandible. Like I said before, buccal, like your cheeks. These directions are very important because when it comes to explaining things to your instructor and writing your notes, they want you to be very specific. So you have your anterior teeth, canine to canine, maxillary anterior teeth. This is facial. Mandibular anterior teeth, facial. You can also say labial because it's towards the lips. So this is anterior, then our teeth in the back are posterior. We have our maxillary posteriors and mandibular posteriors. Like I said, we call them buccal. You can say facial too, but buccal is better. What is opposite of that? Lingual, and because of our tongue. Maxillary, you can say lingual, but it's more accurate to say palatal. Directions are very important too. This one I struggled with in the beginning. You have your mesial and distal. Mesial is middle, distal is back, the furthest from the center. Then you also have incisal, which is the edge of your tooth, but these are for incisors. They also call it the occlusal view, but those are for the posterior teeth. That means where teeth bite. Incisal and occlusal are basically the same thing, except one is for anteriors, occlusal is for posteriors. Teeth numbers are very important. That can be another video. We're going to keep going into oral anatomy. So we have these things called vestibules. It's kind of like when you get something stuck up in there. You can kind of think of it like where the ceiling meets the wall, or where the floor matches the wall as well. You have maxillary vestibules and mandibular vestibules. And in those vestibules, you have these frenums. It's little attachment pieces, labial and lingual. That is a lingual frenum. We have the gingiva, the free gingiva, the interdental papilla, and the attached gingiva. And then we have the alveolar mucosa, which you go up a little bit over there, then you have the vestibule. Okay, now up here, we have the hard palate. The hard palate anatomy. We have a little incisive papilla. We have the rugae. Then you go back, you have the soft palate, and then you have the uvula. Straight down the center, where the incisive papilla is, we follow it down, that is called the median raphe. Now the tongue. That part of your tongue is called the dorsal. You'd think it's ventral, but that is your ventral. Think ventral veins, because that's where your lingual viscosities are. That will be asked a lot in clinic. What are those? You also have your lateral side of your tongue. You also have lots of different papilla, which are your taste buds. You have your foliate, fungiform, filiform, circumvallate, which is that V shape. Those are big mushrooms. Those have salivary glands called von Ebner. That's in another video though. Anyway, that's just a quick little rundown of all the things that you might need to know before you start dental hygiene school. I hope this video helped, and I'll see you later. Bye!